Good morning, everybody. So yes, today I'll be presenting one of my pet projects, Sip Til Send. Hopefully everyone has heard about this so far, and hopefully all of your, or most of your patients are on Sip Til Send. So what is Sip Til Send? It's a change to our clear fluid fasting guidelines that adults can now sip 200 mils of clear fluid every hour until they are sent for. So why do we want to do this? First of all, our patients fast for far longer than necessary. This leads to dehydration, leads to patients complaining of things like headaches, leads to increased nausea and vomiting, difficult IV access, and trouble intraoperatively with hypotension and tachycardia, and also trouble post-operatively as well. It is not just happening at St George. It actually started in a hospital in Tayside in Scotland and has since been brought out across most of the UK, and it's quickly being picked up by a lot of hospitals in Australia and New Zealand. So it's at Prince of Wales, RPA, Concord, Sydney Kids, as well as other hospitals across the country. The one thing I did want to mention is that Sip Til Send is its own fluid protocol or fasting guideline. It is actually not currently endorsed by our Australian New Zealand Anaesthetic College. The college guidelines suggest that patients should still fast from clear fluids every 2 hours, although we know that this is often not the case, and on average we have patients that fast for about 12 hours. ANZCA, however, has recognised that a lot of sites are now starting Sip Til Send, and I think it's a chicken versus the eggs situation whereby ANZCA won't change the guidelines until we've shown that it's safe in a large number of patients. It is an opt-out system, so patients initially should all be on Sip Til Send, but they can be opted out from this either by the anaesthetist or the surgeon or whoever's looking after the patient. The opt-outs are going to be patients who are actively vomiting, so particularly those with small bowel obstructions and large bowel obstructions, those patients that are really high risk of aspiration. Also patients that don't want to drink, they can also opt out. Kids are currently not included on Sip Til Send. We are discussing this. So please, any kids that you're booking for surgery, whether it's emergency or elective, they are not on Sip Til Send just yet. If you have any concerns, sometimes some patients may be borderline whether they should be on Sip Til Send or not. If you have any concerns or questions, just call the duty anaesthetist and they'll be able to help you decide whether the patient should be on this or not. Ozempic is obviously a pretty new but popular drug that a lot of our patients are starting to take or be on. The main concern from an anaesthetic point of view is that it delays gastric emptying. So these patients are more at risk of aspiration during induction and extubation during their anaesthetic. Currently, we recommend that these patients stay off Ozempic for a week before their procedure. But trying to make Sip Til Send as inclusive as possible, we still let these patients go on Sip Til Send, and this is in line with a lot of the other hospitals in our Australian network, and it's up to the individual anaesthetist as to how they'll manage this patient intraoperatively. We do have some patients on thickened clear fluids. This is not a clear fluid, so these patients are not allowed to drink thickened clear fluids on Sip Til Send, so they are also excluded from Sip Til Send, and often these are our stroke patients or patients that have trouble swallowing, so they're already at higher risk of aspiration. So we would exclude these patients from Sip Til Send. So coming back to the why we actually wanted to do this. So this is an audit of our clear fluid fasting times for patients at St George from last year. It's an audit of about 250 patients. And we can see that a lot of our patients, are sort of fasting for the 3-4 hour mark. But then as we go further along, we still have patients fasting at the 6 hour mark, all the way up to 24 hours. And that's a long time to be fasting from clear fluids for. Often these are the NOFs that sit on the ward who would really benefit from some fluid. And it's also a lot of those patients that come in from home for their emergency procedures that sit in day surgery all day fasting and then get cancelled at the end of the day. So these are the people that we're trying to capture here. So we launched Sip Til Send in February this year, and you may have seen some of the propaganda that's been around the hospital that basically is, aimed at educating everyone, including the patients, about Sip Til Send. And we also, sent out emails and spoke to all of the CNEs on the wards, as well as DSU and clinic to get everyone on board at the same time. I have done a brief audit of some of the fasting data since Sip Til Send has been launched. This is a review of 75 patients who were on Sip Til Send, and from this you can see that there's been a significant improvement in clear fluid fasting times, and the average fasting time is now about 1.5 hours. And we only had one patient still fasting at the 5-hour mark and no patients beyond that. So I guess, we want to improve clear fluid fasting timelines to make things better for our patients, but our main question is to make sure that it's actually safe. And from an anaesthetic point of view, the main thing we're concerned about is patients aspirating during induction. So aspiration is defined as regurgitation with bronchoscopic or radiological findings consistent with aspiration and/or signs of respiratory distress after the procedure. And it can be bad. Aspiration can be fatal, although it is very rare. And often the cases that are fatal is aspiration of solid matter and solid food. It's not aspiration of clear fluid. And it's often patients that probably should have been managed in a different way. In fact, clear fluid is probably likely to increase the pH of stomach acid. So if it were to be aspirated, you're less likely to have a bad effect from that. The other thing we know is that clear fluids are rapidly cleared from the stomach. So there's been lots of studies showing how quickly it's cleared, and it's cleared exponentially. So a study has shown that 500 mils of water is cleared within 30 minutes of ingestion. So it makes sense that smaller volumes, i.e. 200 mils, is cleared even faster. And, most of the time our patients take longer than 30 minutes to come to theatre, be checked in and get their anaesthetic. From Tayside, they're starting to publish their data. They've had 56,000 patients on Sip Til Send with 6 complaints of aspiration, and these patients were all cleared for home the same day and had no lasting effects. So I think this is really good evidence that this is a safe fasting guideline. At St George, we are also monitoring safety data, and we use the SQUARE system here, which is our St George Quality Assurance Reporting Program. So if there is any evidence of regurgitation or aspiration or any other adverse event associated with Sip Til Send during the anaesthetic team or, the surgical team as well could essentially put this case into our SQUARE system so that we can keep track of the safety of this change. So far, there's no increased aspiration risk with our patients being on Sip Til Send, and this is consistent across the UK and across our Australian New Zealand network as well. So what now? So obviously we will continue to audit the fasting times to make sure that Sip Til Send is actually working. We also obviously monitor our safety data to make sure there's no increased risk to our patient being on clear fluids. The other thing we're now talking about is introducing this for our paediatric patients. I know a lot of people are keen on this, including the wards. The Sydney Children's Hospital has been on clear fluid protocol since 2010, and it was rebranded last year as Sip Til Send, and they've shown no increased adverse effects to their paediatric patients, which is very promising. So from you guys, I'd like to know if there's been any barriers to introducing Sip Til Send, if there's been any issues, or if you've noticed any adverse effects that we may not have recorded, and if anyone has any questions or comments.